You ever look in the mirror, notice those little white spots on your teeth, and just wonder what they are? Well, it's a super common thing, and today we're going to break it all down. Let's dive right in. So yeah, if you've seen a little chalky patch on your tooth, you are so not alone. But you know, these spots are more than just a little cosmetic quirk. They're actually a signal. Your teeth are trying to tell you something. Let's figure out what that is.
Okay, so what are these white spots, really? Getting a handle on this is the first and honestly the most important step, because they're often a sign of something deeper going on.
To put it simply, there are these chalky-looking patches on the surface of your tooth, and the key thing to get here is that they're a sign of mineral loss in your enamel. It's kind of like the very beginning of a change in your tooth structure.
Exactly. That's why you got to think of these spots as an early warning flare shot up by your enamel. You know, that super hard outer shield that protects your teeth. It's a clear sign that that protective layer might be getting a little bit weaker.
So, if it's a warning signal, what's actually setting it off? It's time to play detective and uncover the 5 main culprits usually hiding behind these white spots.
All right, the reasons can be all over the map. You've got fluorosis, which is just a fancy way of saying too much fluoride while your teeth were forming as a kid. Then there's enamel hypoplasia, where the enamel just didn't develop quite right. And then we have the big ones: demineralization from plaque, a diet heavy on sugary and acidic stuff, and even dry mouth, which means you don't have enough saliva to protect your teeth.
Now, demineralization is by far the most common cause. When that sticky film of plaque builds up, it churns out acids that literally start pulling minerals right out of your enamel. This is a huge issue for people with braces because, let's be real, cleaning around all that hardware is tough.
So we know the causes, but what can we actually do about them? Well, here's the good news. These spots are very often treatable. Let's walk through the options, from the simple stuff to the more advanced solutions.
Your dentist is almost always going to start with the simplest, least invasive options first. And the goal here isn't just to make it look better. It's about actually making the tooth stronger and healthier overall.
You'd be surprised, but sometimes a really good professional cleaning is enough to make a difference by just getting rid of surface stains. Fluoride treatments are another fantastic first step. They help put those lost minerals back into the enamel, basically strengthening that weak spot from the inside.
But, okay, what happens if those simple fixes just don't cut it? Well, for the more stubborn or obvious spots, don't worry, there are some pretty cool advanced treatments out there.
Let's run through them real quick. For really shallow spots, there's microabrasion, which gently polishes away a teeny tiny layer of enamel. Teeth whitening can sometimes work by lightening the tooth around the spot, helping it blend in. A really fascinating one is resin infiltration. It actually gets inside that porous spot, fills it with a resin, and makes it match your tooth color. And for the most severe cases, you can always get veneers to create a completely new, perfect-looking surface.
Of course, the best treatment is to not need it in the first place, right? Prevention is key. So, how do you protect your enamel and stop these spots from ever showing up? Here is a simple 5-step game plan.
The secret to prevention is just being consistent. It all kicks off with solid hygiene, brushing and flossing to keep that plaque away. Watching how many sugary and acidic things you eat and drink is also a game changer. Use fluoride like your dentist tells you to, drink plenty of water to keep your mouth healthy, and, you know it, those regular dental checkups are absolutely crucial for catching problems before they start. All right, to wrap things up, let's do a quick rapid-fire round and tackle the 2 biggest questions people have when they see these white spots.
First up, the big one. Are these white spots basically a cavity in training?
And the short answer is, yeah, they can be. A white spot is really the first visible sign that your tooth is losing minerals. If you just leave it alone and that mineral loss keeps going, it can definitely turn into a full-blown cavity. That's why jumping on them early is so important.
And the other question on everyone's mind, am I stuck with these things forever?
Thankfully, the answer here is often a big no. Like we just saw, there are tons of effective treatments. From rebuilding the enamel with fluoride to those awesome cosmetic options like resin infiltration, it is totally possible to make them way less noticeable, or even get rid of them completely.
So, when you boil it all down, a white spot is a message. It's a direct signal from your teeth about the health of your enamel. The absolute best thing you can do is talk to your dentist. They're the only ones who can tell you what's really going on and set you up with the right plan. So your smile is sending you a signal. The only question is, what are you going to do about it?